The concept of dysplastic nevus is problematic. It was introduced in the 1980s by Dr. Clark and Dr. Elder, and it was thought that lesions which previously had been diagnosed as melanoma were an intermediate lesion which was an obligate precursor of melanoma. So in their hypothesis, melanomas developed from ordinary nevi which underwent changes that were accompanied by changes in appearance and changes in pathology, and eventually these lesions became melanomas. And this idea has become entrenched in the last 30 years, but it's a controversial area, and many people practicing in the field of melanocytic pathology and melanocytic medicine challenge the hypothesis. And there's a number of reasons why we should. Firstly, dermatoscopy has shown us through serial observations and serial photography that most melanomas arise de novo from ordinary skin. And those which are associated with the nevus develop in the nevus, but the nevus itself does not transform. A second problem with the hypothesis of dysplastic nevus is that pathologists have graded the degree of dysplasia. So it's very common for a pathologist to make a diagnosis of mild or moderate or severely dysplastic nevi. And the problem with this is that it is not reproducible. So a case which I might diagnose as severely dysplastic might be called an ordinary nevus by a second pathologist, or mildly dysplastic, and several large studies have shown that to be the case. And even experts find it difficult to agree amongst themselves and agree with themselves when they are presented with the same slides on a second occasion. So because grading of dysplasia is not reproducible, I think it should be abandoned. And our approach to diagnosing melanocytic lesions is that there are 4 types of melanocytic lesion: nevi, melanomas, melanomas arising in association with nevi, and I don't know. And I think this approach allows practitioners to make pragmatic management decisions, whereas a diagnosis of moderate dysplasia presents the clinician with a number of options, none of which are soundly based with evidence.